I brought a few different type of appliances. There's many different designs on the marketplace. The majority of almost all of the appliances work on the premise of keeping the lower jaw stabilized and somewhat advanced, so that we create more space for the tongue and we don't get the tongue back in the throat clogging things up for airway wise. They'll all have two components to them, one that will fit over the lower teeth, one that will fit over the upper teeth. And again, we're looking at a jaw position where we're wanting to stabilize that and not allow the lower jaw to drop back. This particular appliance, the SomnoMed, is probably the most popular appliance in the world. More of those are made than any other. It's the one I've worn myself for about the last 5 years. And so it has a piece again that goes over the top and the bottom, and it stabilizes the jaw position through these wings on the side of the lower appliances, which will, you still have freedom of movement. You can get a drink, you can talk, you can answer the phone, whatever if you need to during the night, but it stabilizes the position there. If somebody tends to be a mouth breather, that's why these wings are a certain height, to still stabilize the jaw position. And in some cases we will even use some rubber bands to help encourage nasal breathing, which makes everything work more effective, either oral appliance or CPAP. So that's basically the concept of the appliance. They're all adjustable. You'll see the over-the-counter ones advertised on television, though, where you can boil it and bite into it and you get one position. Those tend to be very bulky and not very durable. They actually do work in some cases, but not near as effective as the custom appliances like the SomnoMed. But it will have an adjustment, so we will start with a jaw position that's relatively mild and make sure we establish comfort for the patient, because if they're not comfortable, they're not compliant, it's not going to be effective. It's like wearing eyeglasses. If you're not wearing, it's not effective. So we establish that first, and then the appliance is adjustable here through this mechanism, where it can be adjusted as little as 1/10 of a millimeter at a time, so that we can gradually work to find the most effective position for the patient. And we're getting their feedback on how they're feeling, how they're sleeping, or getting feedback from the bed partner, how snoring is, gasping, those kind of symptoms that they may have had before. And then after a few months into the treatment, we'll always do a home test and possibly even a lab test to verify that the appliance is being very effective for them. There's all kinds of different styles. This one is a Herbst appliance, the same concept. It uses these metal sleeves on the side to establish jaw position and allow advancement. It is one that is currently used a lot for Medicare patients, if you have Medicare coverage, because Medicare doesn't cover all different types of appliances, and this is one that they do, so we use quite a few of those, and they're very effective. This appliance is, for short, is SUE, which is an acronym for a longer name, but it again offers the same concept. One thing we really like about this appliance is very durable. There's very little acrylic. It's mostly the metal that's there, which is very strong. This has like a 5-year warranty, which is amazing that they warranty it that long. But it again offers the same concept, and it creates a lot of space for the tongue with the design that they've come up with. So again, it's a very effective appliance.